Welcome. My name is Ryan Bellikop. This lecture is going to continue off of what we were doing with lower back injuries, especially regarding manual materials handling. So by this lecture, we should discuss the causes of back pain, examples of low back pain, and what we can do about it. So again, even though manual handling is exactly what it sounds like. It encompasses more than we think about. So carrying, lifting, pushing, pulling, holding. So this definition, any thing you are performing as a worker, manual handling, when you support or transport a load by hand using your body. So when we think about injuries from manual handling, the first one we should think about is accidental injuries, especially with loss of footing, such as slip, trips, and falls. So think of a cord that a worker trips on while they're holding something. So this is the number one reason for manual handling injuries. And then second is overexertion. We've already talked about this with the back, so that's the number one. But with material handling, remember it's number two. And so what happens is damage to that myotendon failure. So remember that's the primary cause when we go through primary, secondary, and tertiary. And lastly, we have cumulative trauma. As a healthcare provider, most people that come see you is due to cumulative trauma, but with work, it's number three. So even though this source is a little old now from the Department of Labor, we can see nurses, especially nurses' aides, commonly have musculoskeletal disorders, usually overexertion from lifting. We'll have a section on just healthcare workers alone, but this is worth noting. Also, when we looked at kind of factors about strains, sprains, truck drivers are number one, which might seem odd, but I want you to remember that static loading, sitting in their truck for 12 hours a day is really hard on that body. And then number two, even though we've got drastically better about vibration traumas, these are big trucks, carrying 20,000 pounds or more. So the engines give off quite a bit of vibration. So also really bad for the back. Then we have the other sectors. So we already talked about nursing aides and RNs. We especially talk about it because this is a pretty big sector and they have lots of musculoskeletal disorders. So number three, general labor. Number 18, LPNs. So that would be that associate level of the nursing. So, two things you should be thinking about with, injuries for material handling. And number one is the weight of the load. And number two is the distance from the body. We're going to really go through this with like NIOSH lifting equation. And each will have a modifier, which you'll see 51 pounds if it's right, gets your body right dead center. And then it decreases based on that modifier of, 7 different factors. So the distance from the body is also called the moment. So you'll often hear physics people say the moment arm. Same thing. Often in ergonomics, they also say that. So one thing we're thinking about when we're talking about overexertion and the distance from the body, we also don't commonly think about we're also lifting half of our body. So when we bend down, even though we are lifting that 30-pound box, we're also lifting half our body weight, which is a lot more than that. So that combination of factors of external and muscle contraction all contribute to this overexertion. Strength of lifting action may not control the weight, thus overexerting. Out of balance, and so one easy thing to think about is if we're twisting, the center of gravity is way over here, so making overexertion, even more likely. And then that body flexed, our spine is designed for compression load straight on. So when we're flexed, we're actually putting a lot more pressure in that back disc. So levers, this will be on the test. So we got 3 classes of levers. You guys have had anatomy. This guy here, using the skill saw, we could see that even though, this is about 15 to 20 pounds for that saw, he's putting a lot more force focuses because the distance from the fulcrum to that weight is pretty great, that he's using extended. So when you think about classes of levers, I want you to think about the fulcrum, the resistance, and the load. And to go over each one of those, the first one, this is the most classic scenario for a class 1, not as common. So think of your cervical spine right in the middle. That pivot is in the vertebrae here. And so our muscle, the force, is actually the muscles in our neck pulling down to lift our chin up, for example, and our weight is the weight of our head. So this is a good example of a class 1 lever. So class 2, this is a little less intuitive. So on this one, we're using the foot, we're using those knuckle joints called that metatarsophalangeal joint here. Just like the hand, we got our MPs here with the foot, very similar. So our pivot is actually that MP joint. Our weight is the weight of our body coming down, straight down. So it's at the very end of it. And then we have our force, which is that soleus, the calf muscles, gastrocnemius, that is allowing us to go up on our toes, for example. So this is a class 2. Lastly, we got class 3. This is probably the most common that we're thinking about. So think of our bicep. We're flexing it here. So our pivot joint is the elbow joint. The force is all the way at the end with our hand. Lifting, the example on here is 10 kilograms. Our force is that bicep muscle contracting. So this is probably the most common lever that we think of is class 3. So you'll need to know each one of those for the tests. It really allows us the muscles to produce movement of the arm at the most minimal force for our body. So it's a good one and probably the most common. It gives us a mechanical advantage. All right, so this is the mechanisms of the lifting. So we mentioned moment, and so we got lots of moments, which I had, mentioned a little bit earlier. So we got the load of lever lifting. In this example, maybe a bag of groceries, for example, or something like that. So that's the load moment. But we're also lifting the upper body. So that also goes into that load. And then we got the muscle movement, which is the back muscles keeping them either static or, contracting those muscles to go upright. And so what happens is then we get compression forces to the spine. And then we look at the distance from where that pivot joint is. So in this example is that L5S1 joint to the distance of that load. So that's the D1. So those are the mechanics that we need to consider for the body when it comes to carrying a load. So therefore, the muscle tension and the muscle leverage equals the body moment, and the load moment. Everyone keep it, static. So the muscles are working at a mechanical disadvantage. Forces may be 10 times the weight of the load or more. So things to consider. Again, looking at, those pivot joints, closer to the body, you want to have a easier time lifting. So this guy is what we call a stoop lift. So he's not lifting with his legs, right? That pivot joint still, probably L4 on this guy. And that distance is quite high from that pivot joint to where the center of that load is, quite increases. So if we move that pivot joint over, it could be a factor of 10. So if we get it right under what we're actually moving, it dramatically decreases. Then not only do we need to talk, we've already really stressed this, main two ones is closeness to the body and the weight of the object. But then we got other factors, right, about lifting. So others, how much we're doing it. And so if we're doing it twice, more than twice in a minute, it's considered repetitive. And then, we got infrequent and those type of things. So sustained force, meaning we're holding it more than 30 seconds at a time. These are just ergonomic definitions that they put into place. So we're all the same terms. So sustained, meaning we're holding it more than 10 seconds. If it's repetitive, it's more than 2 times in a minute. So keeping it close to the body, this just goes to show, again, that NIOSH is 51 pounds, not the 50, but it's pretty close. We want to keep it close to that body. That green is doing okay. Notice how much the distance decreases by how far is from the body. If it's an outstretched arm straight ahead, it should be no more than 35 pounds. And as far as we can reach, dramatically decrease at 20 pounds. Same with anything that's going to be over the shoulder pretty much, in that red zone, and anything below the knee in that red zone. So those are things that want to really compromise us, dramatically increasing the moment, because it's a increase from not only the load, but our body weight too. So that goes to show how those things combine and some numbers for recommendations. So this, those in between each vertebrae, they don't like twisting. And the reason being is if we have trauma to that, fibers on the outside and it's pushing through, think of a sponge ringing through, it's going to actually cause that nucleus pulposa to push out even more. So we want to avoid lifting. We want to, they always say your toes should follow the load, or nose follows the toes. And that just keeps our body straight ahead instead of twisting our back. So Bill Maris, he's at Ohio State. He's one of the low back experts. He's been doing this for many decades. So this is an example that he goes through for a mechanical injury model. He looks at the forces, then how it damages the end plate, causing microfibers on the end. We often talk about how those discs bulge first. So usually that's the first indication. It's because of these microfractures to the end plate. When we get those, it causes a scar tissue. Those discs act with diffusion, bringing the nutrients in and out. So if we have scar tissue, that nutrients dramatically decrease, so our healing rate decreases. Then, unfortunately, we get degeneration. So we're all at a certain age are going to face degeneration of the bones, especially when it comes to the spine. This decreases our tolerance. Again, all resulting in more serious spinal injury. So just a cascade from this biomechanical model from Maris. So then he just progresses at how, our symptoms go from discomfort, then we get more symptoms like that burning, achy pain, then we have that disorder, then we go from job loss, and then restrictions, and then hopefully, the worst case scenario is that, total disability. So this is just progressing over time. So Dr. Maris's conclusion is that low back pain is multifactorial. Lots of things build up to the causing this like cumulative trauma. Even though we might be lifting item, and it causes that back pain, usually it's a buildup. And then so when we're feeling those symptoms, injury has already occurred to those end plates that's been happening over and over, which makes worker comp really complicated. But let's just narrow it down. Those micro traumas were probably already happening at that work. So even though it's pretty complex and they want to separate it and say, oh, it could have happened from my other job and those type of things, usually it's not as that distant. It's all related. So we talk a lot about keeping the item close to our body, and that, we call this from tops of the hips to the chest level, that power zone. And really, this goes to show where our core helps stabilize our spine. And so that's the other reason for that region. So we think about our core, there's different layers. So we got our six pack on the outside, but transverse abdominis is really our key core muscle that wraps around from the spine going all the way around. And it acts like a back brace. But it's way better than any back brace that we have. And so this goes to, some of the messes. So even though back braces are not meant to stabilize, so this is where we kind of got it wrong. Back braces are more meant to keep, it indicates to our proprioceptors, hey, we're bending too much, stay more upright. This is how our body's moving. So more of a feedback mechanism. It's not as much actually a stabilizer. Our muscles, our core muscles are what's stabilizing. And so other things, so our back brace is bad? No. But they're not doing what we usually think they're doing. Again, we talked about those truck drivers, being one of the top sectors for muscle strains, and that static postures is number one. But, many people during the course of their work are doing a lot of static factors. If you're serving tables, which is the number one occupation in Montana, you're standing a lot. And so just that. But if you're a construction worker, for example, this guy's, lifting overhead, just holding that static posture. Kneeling, we don't think about kneeling, but usually people are not crawling on their knees. They're just kneeling, constant pressure. So those postures are not good for us. They reduce the blood flow to the muscles, lead to fatigue. That's why onset faster. So other ones, posture, looking down, for example, or looking up, both of those, again, examples of it, static postures. So this just goes into the factor, and my head is blocking this last one, but we'll go through it. Resting, the blood needed to those muscles versus the blood flow, pretty low at the same. If we're actually running, for example, the blood needed and the blood flow is both high. But for static postures, the blood to hold that force out is high, but the blood flow going in is actually really low. And that's what compromises us with static postures. So we'll repeat this. Oftentimes we're talking about, the weight of the object, how the distance, psychosocial, very important. And it's a general term. But notice here that many factors are actually interplaying on this, as far as how we feel our support is with work, how much control we feel like we have, the demands placed on us. Maybe they're saying, oh, we need to produce 100 a day and we're only producing 70. So that's going to affect our psychosocial. If we have lack of role modeling, lack of fairness, management, all of these factors go into psychosocial. and they can positively affect, but many times they have a negative effect if any of these are lacking. And what we have actually shown before I go to the next slide is psychosocial plays a huge factor. Two workers that have a work comp injury, the one that has a low psychosocial factors are less likely to go to work, more likely to get injured. So this is a huge human factors issue. And then these are some of the, guidelines that we have. So we're looking at that L5S1 joint. There's compression factors that we're thinking about how much should be able to tolerate. So these are just giving examples. So on this one, it says metabolic rate at 5 kilocalories per minute for most individuals. So that's quite a bit. If we're walking, that's probably about 2 kilocalories. And so 5 is quite a bit. They're hustling. Other things to think about is only about 25% of men and less than 5% of women should work to their muscle strength. So remember, even though we have these guidelines, men usually have much larger bodies. And then we have the action limit. So remember, for aerosols, for example, usually the action limit is about 50% of whatever the permissible exposure limit is. And so similar with this, we're looking at 770 pounds, usually in ergonomics, we're talking about newtons. So we'll definitely go over this again, but I just wanted to do an introduction. There is guidelines that have been investigated, lots of research about this, what they should be. So other things that we've pretty much indicated, material handling is hazardous, especially to the spine, because those compression forces, and even though the spine has so many joints, it all stacks up and gets put at the very bottom. So that L5S1 is where usually we find the most injuries with the back. And that's just because of how everything is laying. It is the foundation for everything when it comes to the spine. So hierarchy of controls, again, we got elimination, substitution, engineering, administration, and PPE. So if we want to try to eliminate conveyor belts, so the people are, not really moving that material. So that could be a good example. Substitution, one research study that I performed with a group is looking at concrete bags, a lot of times they're 90 pounds, which is quite heavy. So if we decrease it by half at 45 pounds, this would be an example of the substitution, changing that object they're lifting. Engineering controls, rather than a person lifting it, you could use a crane, a hoist, pulleys, all of those would be engineering controls. Administration, think of that as the people. So instead of a 1 person lift, you could do a 2 person lift. And finally, in PPE, this is a last resort. And so with material handling, wearing gloves, it could give you more friction, it can protect those hands. But it could do the opposite. So a lot of times these PPEs actually can compromise when material handling. So it depends. All right. So other things we talked about, tools that we could use, lots of tools for lifting. Just some examples that are really common. Lift trucks, probably the most common in the factories that we're seeing. Pallet trucks, everything with manufacturing is on pallets. So pallet trucks are very common. Conveyors as well. So all of these are good tools to help avoid our lifting in the hoist. Less common. So let's do an example. Our case study is going to be in the healthcare. In this one example, we have a nursing aide that's positioning a patient in a bed. So I would like you to, before we go to the next slide, think about some risk factors for those musculoskeletal disorders, and then identify some hazards that you see around the room. Think about this, you're going to a nursing home, they're repositioning, and determine the cause of the primary risk, and determine some safe ways to perform that task. So pause this, write some things down, and let's go through it. So let's say we have to reposition it because they're trying to inject a medication. So they want it in a soft tissue, maybe the glutes, for example. So with that, usually the nurse is, doing a back bend and a twist because usually they're not right over that patient right in there. They have to create a little space between them and the patient. So that could cause maybe a trip hazard because the phone is on the floor going up. Looking at if the bed is too low, so that could cause them to bend even further, right? Or if there's a railing, that could be an obstacle. We did a study about the bed height optimal. There's a progression right now for aides to actually put the beds as low as they can go. But what we found is, usually that mid-range is optimal because it gives that patient the ability to, help lift themselves, as well as when we looked at the motions of the worker. Obviously, when they have to bend more, move more, there's more risk. So when it was midway, they could just usually stabilize and hold still and not do any lifting and have the patient do most of the lifting. All right, so we pretty much went over this. This just adds a couple other factors, not only with the low back, but usually if we have to, bend down more, the neck is actually also bent, using more force from not only the back, but also the shoulders. So the weight of the patient is a huge consideration. So this gets complicated with patient handling. So some patients are very mobile. Usually I put them in three brackets. They're mobile, they're mostly mobile, they can do their activity, or they're not mobile at all, and you have to do pretty much all the lifting. So, those three scenarios, it's going to really vary the weight that you have to do as a worker. So safer ways, other things to consider is access to that patient. Um, assess the environment for all those slip, trips, and falls that we mentioned. Maybe one research thing we did in Puerto Rico, the homes are much smaller. So usually they're one bedroom, less than 1,000 square feet for their homes. So there was a lot of things in their way causing that nursing aide to bend a lot more to access the patient. Things we could do, especially if that patient is not mobile, is use in the equipment such as this Hoyer lift that we see at the bottom right. And so having use these Hoyer lifts, they're not very convenient. For one, the patient doesn't feel very safe because they lost total control and they're just hanging there depending on this equipment to, handle them. Two, they're very slow, they're cumbersome. We mentioned in that Puerto Rico Oral Hospital bed, those rooms are small. These Hoyer lifts are big, just to create that stability. So they're cumbersome, they're hard to move around. Even though it can help reduce it, most of the time, when I was doing this scenario, helping out as a nursing aide, we didn't use them because they just got in the way. So, just to test your knowledge, what is the best way to lift? So, do we want something at arm's length? close to the body, or dragging it? So pause this and come up with your answer. And so for this one, we wanted the best way for lifting, again, close to the body. So really want to emphasize that. All right, so that concludes this lecture on material handling with back pain. Thank you so much.